Hey everyone, this is Emma. So, there seems to be a lot of confusion about the novel coronavirus, including the basics like the name of the virus and the name of the disease that it causes. So, I'm going to attempt to clear up a few things in this video and also ask you some important questions that I've also been asking myself. So, the novel coronavirus is called SARS-CoV-2. It was named by the World Health Organization on February 11th. SARS-CoV-2 stands for Severe Acute Respiratory Syndrome Coronavirus 2. It is a virus, just like various strains of influenza are viruses. And I'm not saying that to say that they're similar. I'm just drawing the comparison that those are both viruses. Likewise, HIV is a virus. It is not a disease. Some people infected with the virus, SARS-CoV-2, go on to develop a disease called COVID-19. That disease is caused by the virus. As you can see in this article that I published on February 11th, the disease was also named by the World Health Organization on February 11th. It says, according to officials, the CO is for coronavirus, the VI is for virus, the D is for disease, and the 19 is for the year in which it was first detected. Unfortunately, a large number of people, a huge number of journalists, and oddly enough, even some doctors and other medical professionals are not distinguishing between these two things. So not only is it incredibly confusing, but it's also allowing a lot of room for doubt and conspiracy in places where there really shouldn't be any or very much. So instead of correcting these errors or speaking up about all of the confusion, unfortunately, the World Health Organization quietly changed the way that it's been referring to the virus. We can see on their website where they talk about naming the virus. Like I mentioned, it says that it happened on February 11th. But down here, it says, what name does WHO use for the virus? From a risk communications perspective, using the name SARS can have unintended consequences in terms of creating unnecessary fear for some populations, especially in Asia, which was worst affected by the SARS outbreak in 2003. For that reason and others, WHO has begun referring to the virus as the virus responsible for COVID-19 or the COVID-19 virus when communicating with the public. Neither of these designations are intended as replacements for the official name of the virus as agreed by the ICTV. Material published before the virus was officially named will not be updated unless necessary in order to avoid confusion. It's a little goofy that they point out there that they don't need to make changes unless it's in order to avoid confusion, because there is now a lot of confusion because they have stopped using a different virus name and a different disease name. I also honestly can't see why the WHO would do this for the reason that they listed. I think advising people to not call it the Chinese virus or to not call it the Wuhan virus is certainly reasonable, but what are the unintended consequences of using SARS in the virus name? 774 people died from SARS. Anywho, it is very important to make the distinction and to understand that COVID-19 is a disease. So viruses exist on a spectrum of not a very big deal to being a deadly pandemic that we are seeing right now. Sometimes a virus can invade our bodies, but our bodies fight them off. So we don't have any symptoms, or we might not have very many symptoms, or the symptoms are so subtle that we don't quite notice them. Sometimes viruses invade our bodies and begin to replicate by hijacking our cells and destroying them as the virus multiplies, which is the goal of the virus typically, and that makes us sick. Some common viruses include hepatitis, influenza, mumps, rubella, human immunodeficiency virus, which is HIV, herpes, dengue virus, Ebola virus, varicella zoster virus. Some viruses go on to cause infectious diseases such as influenza, acquired immunodeficiency syndrome, which is AIDS, dengue fever, Ebola, chickenpox, etc. So let's take a step back and look at what we have. We have a virus that is called SARS-CoV-2, and we have a disease that is called COVID-19. The nasal swab test, which is the most common way to test for infection, tests for the virus. They stick the swab up your nose and it goes all the way back here. It sounds very, very unpleasant. I know a lot of people have probably had the swabs that go in the back of your throat for like strep or something like that, and that's unpleasant enough. But these swabs go all the way back here, and the results of that test are either going to be positive or negative, and they'll indicate that the virus is in you or the virus isn't. You might have symptoms and you might not have symptoms. The nasal swab test does not test for the disease called COVID-19. So why is it that on many of these maps, many of the articles, even statements from doctors and nurses talk about someone being positive or negative for COVID-19? As far as I can tell, that is not possible. And this is an especially important point to consider for those that think that the death counts and the cases of the virus are being falsified and that they don't really match up. If you are very ill and you go into the hospital because you can't breathe, the attending team of healthcare providers is going to try to help you breathe. They want to save your life. That's their job. I'm not a doctor and I'm not a nurse, but I can say with certainty that their goal is to help you as quickly and efficiently as possible, not to prove whether or not you have SARS-CoV-2 replicating inside of your body. While there are new and quicker technological advances being explored and used for testing right now, the results of those nasal swab tests that go all the way back here typically take about 3 or 5 days to return. So when a patient can't breathe, they don't have 3 or 5 days to wait for the test results to come back before the doctors and nurses tending to them can decide what to do. So they do what medical professionals who have the goal of saving lives in a fast-paced environment do, whether or not there's a pandemic. They look at the available evidence in front of them and then they act on it. That's not strange. For patients ill thanks to the coronavirus, observing the patient and then doing things like looking at their blood oxygen saturation level and checking for anomalies in their x-rays or their CT scans of the lungs will help a doctor decide if a patient appears to have the disease COVID-19 or not. Do you think that if the nasal swab test came back quickly or came back in 3 to 5 days and it was negative, the course of care would change? I don't think so. So what if you were in the hospital, you were lying in the bed, your nasal swab came back negative, but you couldn't breathe? Would you want them to continue working like you have COVID-19 and try to save your life? Or would you stop and say that you've reached a dead end because you tested negative and you can go home now? So this is where I've spent a lot of time thinking and I've come up with some questions. We have a virus and we have a disease. We have a test that tests for the virus, not the disease. And I'm not talking right now about the blood tests that test for antibodies. I'm talking about the nasal swab tests that test for an active infection, for the presence, the RNA of the coronavirus. So we have asymptomatic people at varying levels of severity when it comes to symptoms. What if some of the different options look like this? Can you have a positive SARS-CoV-2 test and not have symptoms because your body is winning the battle? Can you have a positive SARS-CoV test and have basic, not severe symptoms because you have a viral infection, not a disease? Can you have a positive SARS-CoV test, have those basic symptoms, but also have severe symptoms that are of the disease, COVID-19? Can you have a negative SARS-CoV-2 test and have symptoms of COVID-19, the disease, because the virus ran its course in your body and you're no longer fighting an active infection of the virus, but you have the resulting disease that some people end up having after they've been infected by the SARS-CoV-2 virus? If so, that could clear up some of the confusion about why there are false negatives, because they might not actually be false. What if you're done fighting the viral infection, you're done fighting the virus, but now you are suffering from the resulting disease? So if we can make a distinction like that, it really calls into question all of the data that is being tracked and the way that it's being tracked. On these maps, we're simply tracking positive test results of people who at the time of testing were actively infected with the SARS-CoV-2 virus. Is anyone keeping track of how many people have been diagnosed with COVID-19 because as I've repeated many times, those two things are different. Speaking of being diagnosed with COVID-19, I mentioned a little while ago that CT scans and x-rays and blood oxygen saturation levels, in addition to probably other things that I'm not aware of because I'm not a doctor or a nurse, are being used to decide if someone has COVID-19 or not. Some people think that this is a terrible thing and a sign that there's some sort of fraud happening here. But I think it would be really helpful to understand how diseases are sometimes diagnosed, especially in a life or death situation. Personally, I have firsthand experience with not a life or death situation diagnosis, but being diagnosed with a disease, with lupus, and my mom being diagnosed with multiple sclerosis, MS. A single test cannot diagnose someone with lupus. I was very frustrated by this growing up, and it was hard to understand how this system worked, but it's just the way it is right now. There is not a magic yes or no thing to look for if you want to potentially diagnose somebody with lupus. In fact, there's a list of 11 things, and you need to have at least 4 of those 11 things to secure the diagnosis. So when I was a kid, some doctors looked at me and looked at my symptoms and looked at that list, and they thought that I had lupus. Some other doctors didn't. So they didn't agree because there is no magic yes or no. There is no one blood test. It's a list of things. So it's a little bit open to interpretation. And sometimes that happens in medicine. It's just the way it is. It is not black and white. I know a lot of people want COVID-19 to be black and white right now, but for a lot of reasons, it isn't. And that's not weird or suspicious at all. Likewise, no single test can diagnose multiple sclerosis. Have you heard of Lyme disease? That one is notoriously difficult to diagnose because we don't know enough about it yet, and different people think different things about it. That's diagnosed based on symptoms and physical findings as well. Again, that is completely normal. That doesn't mean it's not frustrating or confusing, or it doesn't leave room for misinterpretations or differing opinions. It's just the way it is. So if you are incredibly upset that COVID-19 is being written on death certificates when the results of the nasal swab have yet to be confirmed, I really don't think you understand how any of this works. So let's take a little bit of time to talk about the death certificates. I'm going to read some excerpts from a 2003 CDC manual called Physician's Handbook on Medical Certification of Death. Here's the cover. And I'm going to go down to, I believe, page 9. Medical certification of death. And down here, it says, cause of death. This section must be completed by either the attending physician, the medical examiner, or the coroner. The cause of death section, a facsimile of which is shown below, follows guidelines recommended by the World Health Organization. An important feature is the reported underlying cause of death, determined by the certifying physician and defined as A, the disease or injury that initiated the train of morbid events leading directly to death, or B, the circumstances of the accident or violence that produced the fatal injury. In addition to the underlying cause of death, this section provides for reporting the entire sequence of events leading to death, as well as other conditions significantly contributing to death. The cause of death section is designed to elicit the opinion of the medical certifier. Causes of death on the death certificate represent a medical opinion that may vary among individual physicians. A properly completed cause of death section provides an etiologic explanation of the order, type, and association of events resulting in death. The initial condition that starts the etiologic sequence is specific if it does not leave any doubt as to why it developed. For example, sepsis is not specific because a number of different conditions may have resulted in sepsis, whereas human immunodeficiency virus syndrome is specific. And here's a copy of what a death certificate looks like, and you can see that there's these sections to write different things that it's describing. In certifying the cause of death, any disease abnormality, injury, or poisoning, if believed to have adversely affected the decedent, should be reported. If the use of alcohol and/or another substance, a smoking history, a recent pregnancy, injury, or surgery was believed to have contributed to death, then this condition should be reported. The conditions present at the time of death may be completely unrelated, arising independently of each other. They may be causally related to each other, that is, one condition may lead to another, which in turn leads to a third condition, and so forth. Death may also result from the combined effect of two or more conditions. As can be seen, the cause of death section consists of two parts. The first part is for the reporting of sequence of events leading to death, proceeding backwards from the final disease or condition resulting in death. So each condition in Part 1 should cause the condition above it. A specific cause of death should be reported in the last entry in Part 1, so there is no ambiguity about the etiology of this cause. Other significant conditions that contributed to the death but did not lead to the underlying cause are reported in Part 2. So, we've got people up in arms all across the country right now claiming that death certificates are not accurately detailing what people are dying from. There are claims that if people are very obese, if people have cancer, if people have heart disease or high blood pressure, etc., they are being listed as COVID-19 deaths, despite those other things being part of what caused them to die. But it looks like death certificates have spaces to account for that. Doctors are already instructed to detail the chain of events that led to the death, which might include a disease in addition to an infection or even another disease. So if you have a problem with the way that death certificates are completed, which it seems some doctors who are making viral videos right now of themselves on this topic do, your issue is with the forms and the process, not with COVID-19. I understand the frustration, but in the middle of a deadly global pandemic is probably not the time to complain about death certificates. So the CDC also has a document that is specific to deaths due to coronavirus disease. Let's take a look at that. This document is called Guidance for Certifying Deaths Due to Coronavirus Disease 2019. And I'll just read a few sections on this. Cause of death reporting. When reporting cause of death on a death certificate, use any information available, such as medical history, medical records, laboratory tests, an autopsy report, or other sources of relevant information. Similar to many other diagnoses, a cause of death statement is an informed medical opinion that should be based on sound medical judgment drawn from clinical training and experience, as well as knowledge of current disease states and local trends. It says that the purpose of this report is to provide guidance to death certifiers on proper cause of death certification for cases where confirmed or suspected COVID-19 infection resulted in death. As clinical guidance on COVID-19 evolves, this guidance may be updated if necessary. Again, not strange. This document has been updated a few times. I'm not surprised because this is a brand new thing that we're dealing with, that we're learning about in real time. When COVID-19 is determined to be a cause of death, it is important that it be reported on the death certificate to assess accurately the effects of this pandemic and appropriately direct public health response. Certifying deaths due to COVID-19. If COVID-19 played a role in the death, this condition should be specified on the death certificate. In many cases, it is likely that it will be the underlying cause of death, as it can lead to various life-threatening conditions, such as pneumonia and acute respiratory distress syndrome. In these cases, COVID-19 should be reported on the lowest line, used in Part 1, with the other conditions to which it gave rise listed on the lines above it. In some cases, survival from COVID-19 can be complicated by pre-existing chronic conditions, especially those that result in diminished lung capacity, such as chronic obstructive pulmonary disease or asthma. These medical conditions do not cause COVID-19, but can increase the risk of contracting a respiratory infection and death. So these conditions should be reported in Part 2 and not in Part 1. And the conclusion says, an accurate count of the number of deaths due to COVID-19 infection, which depends in part on proper death certification, is critical to ongoing public health surveillance and response. When a death is due to COVID-19, it is likely the underlying cause of death, and thus it should be reported on the lowest line used in Part 1 of the death certificate. In the conclusion, some people are getting hung up on this part down here, where it says, it is acceptable to report COVID-19 on a death certificate without this confirmation, if the circumstances are compelling within a reasonable degree of certainty. So if someone died before they received the results of the test indicating if they were infected with the virus or not, but the physician thinks that all of the other symptoms that the person is experiencing that ultimately led to their death fit COVID-19, they can write that. I don't think that that's as crazy as some people are making it out to be. So obviously, having the correct cause of death on the death certificates is important for keeping track of this information for when in the future we come back and we look at all this data and we try to do something with it. But more than what's just being recorded on death certificates, deaths in general are up in most epicenters. And again, I know that some people aren't going to believe that, just like some people saw the drone footage of pine caskets being buried on Hart Island in New York City and thought maybe those are actually empty caskets and there aren't bodies in them. So here's a great graph that shows that the potential exists for undercounting deaths due to COVID-19. So if you look here, well, let's see, I'm kind of in the way. Make me go away. Okay. You can see the dates down at the bottom. We've got 2000 up through 2020. And check out this massive, massive spike here of how huge this line is. And right here, we've got coronavirus deaths counted so far. And this is in New York City. Look at all these other deaths. So this whole total is 5,330. We know that 3,350 of them are as a result of coronavirus. But this huge amount right here looks a little bit smaller than September 11th, 2001, but massively larger than all of these other years. And we know that not everybody is being hospitalized that is experiencing symptoms. We know that some people don't have insurance. Some people are concerned about their immigration status, so they don't seek out healthcare. Some people don't have the ability to leave home and get to the doctor. Some people are homeless. We also know in some places it has been confirmed that deaths that are occurring in nursing homes are actually not being counted because those people are not being tested or diagnosed. They just happen to be dying there. We saw in Italy that people were dying at home and they weren't being counted because the system was so overrun, and that this was happening also in nursing homes, that the authorities were going in and finding a whole nursing home full of people that were either abandoned or all dead. And those numbers are likely not ending up in the official count. So sure, we may have a few deaths that end up being attributed to COVID-19 that shouldn't have been. That's inevitable. There is room for human error, always. Mistakes happen. But how many deaths due to COVID-19 or the novel coronavirus haven't been counted and won't be counted? Because that includes deaths that happened earlier this year before we were testing and before we were paying attention, when we could have been paying attention, but we weren't. But that's for another video. So that also includes, like I said, the people that are dying at home, the people dying in the street, the people who are dying in nursing homes. So for example, for every one case that you think might be overcounted, there are probably a handful or more that are being undercounted. But the truth is that we are never going to know for sure. We don't normally have an accurate look at 1 year's flu data until the next season. It always takes time, and even then, it's still just an estimate. So the next time that somebody tells you that the numbers are being inflated and that the death certificates are being manipulated, please show them this video, and maybe it will help them understand a little bit more. Or better yet, please check out the documents that I've shown you here. I will link them in the YouTube description. And look for even more information yourself, and try responding to these people in your own words. If you would like to support my work, there is a link in the YouTube description below to my fundraiser. No pressure there. But also there is a link to the Brave Health store where you can purchase some useful and sometimes hard to find things like hand sanitizer and some vitamins. As always, thank you for watching, and please share this video and subscribe to this channel on YouTube if you haven't already. Thanks, guys. Bye.